Hi, I'm Dr. Jeffrey Riopelle. I'm a cosmetic surgeon in San Ramon. And today we're going to talk a little bit about facelifts and alternatives to facelifts. The facelift procedure is designed to, just as it sounds, lift the face. It's a procedure that's done under general anesthesia typically and has a several week, 4, 5, 6 week recovery period. It's a great procedure. What I'd like to talk to you a little bit about today is alternatives to the facelift, because not everybody has 6 weeks of downtime they can afford to have. And there are a lot of other techniques that we have available to us with more modern technology that can give facelift or near facelift-like results without the downtime and with much less discomfort. So what are these techniques? Well, I'm going to discuss several of them. What are our goals, first of all? Well, what we're trying to do is we're trying to lift the brows, lift the cheeks, lift the nasolabial folds, basically correct the sagging that has occurred over time. As we age, our face actually sags and droops and the skin becomes less tight because the collagen thins. And that sagging leads to what we see as aging. It's one of the components of aging. And we can correct that with a facelift, but we can also correct it with other techniques. Once these techniques are done, we're looking for the face to look lifted, rejuvenated. One is to look much more alert and awake and happy. And so those are the goals. Now the first technique we have is Thermage. Thermage is radio wave energy. This is the Thermage unit. And what Thermage does is it heats the deep collagen to contract the skin and lift. And over about a 6-month period following Thermage, the skin is lifted and tightened. It actually gets thicker as it goes, so not only is it good if you want to have a sort of a mini facelift, but if one actually has had a facelift in the past or one plans a facelift in the future, it will tighten and thicken and improve the skin quality so that the facelift will be more effective, either the past or the future one. Now another great technique that's come along is the silhouette suture. This tiny little suture is the silhouette suture. And what it does is it lifts sort of like a facelift, but without general anesthesia. It's done at a local. One can come in, have the procedure, and be back to work in a few days, although full recovery takes about a week. And what we do here is we make a little incision up in the hairline, and we take the thread and we thread it down through the skin after numbing with local anesthetic, and it comes out in the area that we want to lift, and it ties up here up top. So there are no skin incisions, there are no scars visible, and yet one gets a lifting similar to a facelift, maybe not quite as much as a facelift or quite as strong as a facelift, but very natural. So that's another great technology that we use as an alternative to the facelift. And we can do this technology in multiple areas of the face. We can do the brows, we can do the nasolabial folds and cheeks, we can lift the jowls, and we can lift the neck. We can lift all of those at once, or we can do certain areas if one just has a need for those. It's great for men, it's great for women, it's great for people who don't want to have a lot of downtime and can't afford a lot of time off work, because you can get back to work pretty quickly with it. Another great technology is Smart Lipo. And Smart Lipo is great for the jowls and lifting the neck. Now a lot of times facelifts have had to be performed because the neck is a problem. And the neck, as much as the cheeks, can get saggy and not look good. The Smart Lipo laser has been developed to tighten skin and take out fat. And you can do either in the neck area to rejuvenate the neck. And it gives a very nice result with, again, minimal downtime, a couple days back to work. One comes in, has the procedure done awake. There are little tiny incisions here in areas that you can't see them after they heal. And we can actually take the Smart Lipo, and many people have that double chin or have that extra bag of fats hanging down that just doesn't look that great. And that can be removed very easily in the office under local anesthetic. And following removing it, we can tighten the skin with the laser. We take the fat, first we laser the fat to melt it, then we suction it out, and then we take the laser again and go in and tighten the skin by going underneath the skin and heating the collagen, constricting the collagen. So we can make bagginess that's along this area contract, go away, get fat to go away. We can, as I say, do the jowls. So this is a great standalone technique as an alternative to the facelift when the neck is the main area that needs to be performed. Or it can be used in conjunction with these other technologies that I've mentioned. So when we put this all together, what we're doing is we're trying to get an excellent look with minimal downtime and procedures that can be done awake with local anesthetic. In our office, we're all about creating procedures that have minimal or no downtime. And in today's busy world, I think people really need to be able to get back to work right away, and we're all busy. We don't have 6 or 8 weeks anymore that we can put aside just for full recovery. And that's where these procedures play a great role. Well, we'd like to talk to you more about this, so please give us a call at our office. And also feel free to click on the websites below and take a further look. Thank you very much.